most of you, most likely you have your own routine, day in, day out. Any activities that you do on a daily basis to improve the quality of our health. Health is important. Yeah? We always know that health is always wealth.
Yes.
But we prioritize wealth. We always think first about wealth. Now, I'll be talking how we can improve our health. Definitely, everybody will say, I'm healthy, doctor. I'm still young. Like I said last time, we are all in the pre-illness state. Everybody is candidate to develop certain chronic problems when we grow old. So we always need to look at the family history. Anybody in the family with blood pressure, sugar, cholesterol, heart attack, stroke, cancer, then you are candidate.
Yes.
You understand?
Yes.
So now we'll be talking about our health and how we can improve the quality of our health now and in the future. Talking of health, health is not simply the absence of sickness. It doesn't mean that when you say, I'm healthy, it doesn't mean you don't have problem. Because health is not just the physical thing, but it's like a group of, like a company, it's a group of companies that has different, of course, systems. So, going back to being healthy, we have to have healthy behaviors. So, going back to our lifestyle, are we living a healthy life?
No.
Do we eat healthy food?
No.
Do we have vices? Some yes, some no.
Yes.
But are we eating balanced food?
No.
Because when we talk of health, of course, before I forget, products here in our company will help us a lot
Yes.
Yes.
if we are taking it on a regular basis.
Yes.
So we have different healthy behaviors. Some are smokers. Anybody smoke certain point of your life? Because this is a very common advice by a doctor, do not smoke.
Yeah.
Right?
Yes.
Eat a healthy diet. When we say healthy diet, what is a healthy diet? Do we know what is a healthy diet is? Maintain a healthy weight.
Yes.
Do you think, look at yourself. Do you think, ask yourself, do you think I'm overweight or underweight? Or I have an ideal weight? Because not everybody can maintain an ideal weight. It will always depend on our lifestyle, our healthy behaviors, yeah? And another one,
Exercise.
do we exercise regularly?
Yeah.
Well, here in this modern world, no, we are living in a temporary place wherein we don't have our own time. Majority of people will say, I don't have time.
Right.
Yes.
Because we don't want to give time to ourselves. Like the XN. People, no time. I'm busy, I'm working.
True. True.
People may have time, but they're not doing the right thing.
Yes.
That's why we don't need to smoke, we should eat healthy diet, maintain a healthy weight, exercise regularly. How many are doing exercise? Sometimes.
Sometimes.
How often is sometimes? You know, how often is sometimes? All is good in a certain amount. That's why some people will say wine is good. A drink of wine every night is not bad. That's why drink alcohol in moderation.
Kaya sa
Like wine contains grapes. it metabolism on a certain level. Because people, they just, yeah, it's good, doctor, because I can sleep well. Right? So 1, 2, 3, 4, 5, and the number 6 is you have to get an adequate sleep. How many hours of sleep do we need to have every night?
7 to 8 hours.
7 to 8 hours. 8 hours, 8 to 10 hours, 4 to 5 hours. So many. But since we are working here, we go home late, we watch TV, we watch movies, we watch Netflix. I'm busy with my DXN business, doctor, trying to do prospecting, so we don't have time to sleep adequately. Correct? All right.
Right.
Yes. Right.
And that can affect the quality of our health. That's why living in this part of the world is not very healthy. It will always depend on us. But we need to balance the work and the life. There should be a work-life balance.
True.
Well, we have to work, but we need to enjoy life as well.
Yes.
Well, to enjoy life, it's good to eat, good to drink. Yeah, good to, so it should be in moderation. It should be in the right amount of food, the right amount of alcohol, the right amount of watching movies or whatever extra activities that you do day in, day out. So, healthy behaviors, you should not smoke, eat a healthy diet, maintain a healthy weight, exercise regularly, alcohol in moderation, and of course, adequate enough sleep. So, that's a question now for yourself. Which healthy behaviors are most important? You have seen the 6 behaviors. What is the most important? Weight, exercise, sleep, or healthy diet? So always remember the 6. We can always improve the quality of our health. It's never too late. Always remember the 6 because nobody knows about the 6. Although smoking, you can remove that, but the majority, even if we are taking supplements, eating healthy diet, but we don't have enough sleep, we drink alcohol, we smoke. Well, looking at the healthy diet, very few is having healthy diet. It's very difficult to achieve, right?
Yes.
Because nowadays, every food that we eat contains toxin.
Yeah.
Yes.
In the US, 1/3 of all cancer deaths are related to smoking. Why? How can we prevent the cause, this smoking as a cause of death and cancer? Of course, stop smoking. Help yourself stop smoking also. Your friends. Because if you are the one knowledgeable or we know what needs to be done, then we need to help them. Of course, going to our products, there is one product which is very good that can help you avoid cigarette smoking. Because most of the people who smokes, they are addicted to nicotine. They are hooked to cigarette. Every time they take coffee, they want cigarette.
Yes.
Yeah.
Oh, why do you know? You've been doing that before, huh? When I go to toilet, I want cigarette. Why? After eating, I want cigarette. And most of the smokers will tell me, it's too much stress in the work. We go out sometimes to smoke and relax. But imagine, we can prevent cancer, we can prevent the cause of death because most of the smokers, over a period of time, they develop like the lung problem, breathing problem, develop asthma, develop COPD or like the emphysema, wherein they need oxygen almost every day when So, it increases also the risk of heart disease. So when you smoke, even if you're a passive smoker, exposed every day, chances of having lung problem in the long run is always there, and having heart problem. So tell your friends, your relatives to stop smoking. But you should know how to tell them. You should know how to scare smokers to stop smoking. Well, myself, I'm relatively happy because I have a lot of patients who smokes 1, 2, or 3 packets. They stop one day. The next day, they throw everything. They're happy because they have prevented the possible end results. Quitting, of course, when you quit cigarette smoking, somebody's smoker, that is the best gift you can give yourself. And that is the best gift also you can give to your friends, to your relatives, and to every smokers that you know. Right?
Yes.
So, smoking is one of the healthy behaviors that we need to look into, because so many of our friends are smokers, or relatives even, or family. Well, in the US, they have this, what they call this quick stop smoking line, wherein if you want to be helped, if you want help, you can just call this number, then they will help you how to, and assist you how to quit and to stop smoking. So going into the healthy diet, who is doing healthy diet? Who is eating healthy food? Nobody?
Vegetarian food.
No, with rice.
I have so many patients, Indians. Doctor, I'm a vegetarian. We eat healthy food. I always tell them, go to Rashid Hospital. Go to ICU. ICU is intensive care unit or intensive coronary unit. All Indian patients there with bypass surgery. You ask him, I'm vegetarian. Why they have bypass surgery?
Yeah, because they're cooking.
They eat a lot of ghee. Ghee is good, yeah? Yummy. That can block arteries, the blood vessels in our heart.
It's like a...
That's why even vegetarians, most of them, they have high cholesterol.
Yeah.
There is the good and the bad cholesterol. So we have to balance the calories when we eat, when we say healthy food. Well, everybody loves eating. We need to enjoy our food, but we have to eat also in moderation.
Yes.
What is healthy diet? What is eating in moderation? But try to look at when we have events, parties, or even BX during Ramadan here, or the what they call it, the iftar. Look at the servings that you're getting in your plate. Big servings. That's why when eating, you have to avoid oversized portions. How many are having this type of plate when you eat? There are fruits, grains, vegetables, protein, and dairy. This is a balanced food. How many are having fruits, vegetables? There is proteins, grains, the carbohydrates.
Sometimes grains.
Sometimes. Maybe once in a blue moon.
It's different.
Bloom.
Always
Yeah.
now and then.
True.
But not,
Right?
not
Yeah.
balance in grains and vegetables.
So what are the foods we need to increase when eating? When we say healthy, what are the healthy foods that we need to eat more? So it's saying here, make half of your, try to check your cholesterol, sugar, and sugar is there, cholesterol is there, but blood pressure is normal, weight is normal, but it does not mean that if your weight is normal, you are normal. Because we are all abnormal. Yeah, at a certain point of in our system, we always have some abnormalities or not in the right level, yeah? Because when there is increase in weight, chances of developing sugar, which is the type 2 diabetes, hypertension, the high blood pressure, heart disease and stroke, and some types of cancer is, of course, increases. So you may develop it anytime. Even there is no family history, but you're always a condition wherein when you sleep, you stop breathing. No? You have friends like that. You just wake up.
High breathing, yeah?
Yeah, breathing problem during sleeping time. In the certain point of time, you need like a continuous. They call it CPAP, a continuous happening. Not only in old people but even young patients because of our food, lifestyle, the healthy behaviors. Right? So, talking of this way, even if you are overweight, these are for overweight patients or people, even if you lose 5, 10 or 15% of the total weight,
Fruits, pears and
Tall
then
and small. Tall and short.
apple and
pears.
Pears.
pear, huh? Where you wear your weight matters.
In the apple.
Big, no? And those with pear, the hips are big. And up is still looks slim, but big here. There are shapes like that, yeah? So, where the fat accumulates, of course, it has a big difference. You can hold, no? Others, they cannot hold that because it's the visceral part from the inside, but they are big. So that has a big meaning. Oh. Because those who have patients, senior individuals, you don't need to do strenuous activity actually. So what are the moderate intensity aerobic exercises? Oh, it's not there. Simple breathing comes to alcohol. Because alcohol can increase the risk for certain cancers of the liver commonly, the esophagus, the throat, of course, and that can compromise our immune system and can cause even brain damage because of the complications in the long run. But how much alcohol can we drink if we are drinking? Of course, some of you are drinking here. No? Some of you drink alcohol? Yes.
I drink wine.
Because life is not nothing. If you don't enjoy life, drink. I myself, I drink alcohol.
Red wine.
There is a standard 1 shot of wine. Yeah? And when it comes to a beer, standard drink is 12 ounce beer or wine cooler. 12 ounce. There's a beer, the small beer, yeah? That is one every day will not harm yourself.
The one Corona like.
So those are the healthy behaviors, yeah? That's what we did. Yeah. Don't smoke, eat healthy diet, maintain a healthy weight, exercise, alcohol, and sleep. Okay?
Yes.